Hi, my name is Tony Michels. I'm with Therapy Partners of North Texas, and I'm here today to talk to you about low back pain associated with herniated disc and sometimes leg symptoms that go along with that herniated disc. So what we're going to start with is here's your spine. Okay, simple spine model. What I want you to know from this is that there's the lower portion of your spine is called your lumbar spine. It's made up of 5 segments, 5, 4, 3, 2, 1. And in between each one of these bones is a vertebrae, or excuse me, is a disc. And on the side here you'll see some holes, and this is where the nerve roots come out from each level. Okay? What we're going to do next is we're going to pretend that we cut this off, and we're going to move this, and we're going to draw some stuff and talk about more about the process. So again, these are the vertebrae. So 5, 4, 3. In between each vertebrae are the discs. The discs are held onto the bone by what we call a cartilaginous end plate. You can think of that end plate as a stiff piece of plastic. It's got some give to it, but if it gives too much, it can crack and it can create injury, which can also be a contributing factor to back pain from time to time. And then we have the nerve roots coming out. Now what we're going to do is we're going to pull that disc out, and we're going to turn it, and we're going to look down on it from the top. So the disc is roughly oval in shape. The center portion of it is more fluid-like, and the outer portion is more fibrotic. A disc stays healthy like any other cartilage in your body through fluid transfer. Fluid transfer occurs with movement. So you can think of this as a sponge. When we bend forward throughout our daily routine, those vertebrae come together in the front and puts pressure on the sponge, and it forces the fluid out. We stand back up, the pressure comes off, and it draws in that fluid. The fluid transfer in and out throughout the day is what keeps this tissue healthy and can ultimately help it heal. So let's talk about the normal process, if you would, of how we end up with a herniated disc. Typically it starts early on in life, 12 years old, we do something, we get a little bit of back pain. Maybe we're 14, 15, fall out of a tree, and we get a little bit more of an injury. This time we notice it for a day, doesn't really slow us down, no big deal. We're in our early 20s, we get in a pretty good car accident, get another injury, back pain 3 to 5 days, slows us down a little bit, but ultimately it heals, we recover nicely, and move on. Let's fast forward now, we're in our late 40s, early 50s, we do a big landscape project, we lift something a little too heavy, and we create significant injury. Now, this injury is more significant later on in life because we've gone through some degenerative changes. Those degenerative changes start happening as early as the 2nd decade of life. And there's a lot that goes into it, but in its simplest form what happens is the vertebrae, the bone makeup starts to lay down a little bit differently, and the vertebrae starts to take on this hourglass shape. Now, that cartilaginous end plate is still across there, but because of the changes in the shape of the bone, it's now bowstrung across there, and it just makes it a little bit more susceptible to forces, a little bit more susceptible to injury. So we have this significant injury. Our body does its normal thing. It sends in products to fight the injury. This inflammatory process all comes in towards the center of the disc because the disc is a little bit more hydrophilic, water-loving if you would. Ultimately this absorbs and it starts to work its way out through this fissuring that's been created through repetitive injuries throughout our life. This ends with a disc bulge. This disc bulge is made up of mostly of the fibers and also the liquid that comes with the inflammatory process. This disc bulge can put pressure on the nerve, and it can be one of the ways that it can send symptoms down your leg. Now, this is not the kiss of death. Studies have shown that if you do the right things, that this can heal, this can reabsorb. One great study that they've done is they've done serial MRIs, repeat MRIs, every couple of months, out to a year, 2 years, and what it shows is over time, this can heal, the fluid can reabsorb, and it can get smaller in size. Smaller in size creates space, takes some pressure off from the nerve, ultimately could be enough to help you no longer have back pain. The other relevant study that I want to touch upon that a lot of times we haven't heard about is they've done these big studies where they'll take 1,000 or 2,000 people and they'll give them an MRI, and none of these folks have ever had low back pain in their entire life, but yet what it shows is upwards of 40% or more of those people have a herniated disc on MRI, but it's not problematic. It just tells us that just because we have this, it doesn't mean that it has to be the source of your problem. Lots of people have disc bulges and they have no pain from it whatsoever. The next thing I want to talk about is I want to talk a little bit more about the nerve pain, if you would. So these symptoms going down your leg. What this does is this creates pressure on the nerve and it restricts the blood flow to the nerve right there. That restriction limits the amount of oxygen that the nerve is getting, and it creates what we call mechanical nerve pain. Typically, mechanical nerve pain is more of your numbness, tingly, burny kind of sensation, if you would. The other way that we get leg pain is we get chemical nerve pain. Chemical nerve pain is that process of all of the inflammation has products in it that are irritants to exposed nervous tissue. Right here, this nervous tissue is not covered by any protective sheath. These products in the inflammatory process can go in and can irritate the nerve, and that can send more what we would call pain down your leg. Lots of times this pain is a little bit more significant, tends to be the one that kind of bothers us a little bit more and slows us down a little bit more. We've all had mechanical pain, nerve pain at some point in our life. Sat funny, and our leg fell asleep, had our arms crossed and our arm fell asleep. All we did was we simply limited the blood flow to the nerve at that time, sent the symptom down your arm or leg, you got up, moved around, restored the blood flow, and your arm was happy and healthy again. So let's talk about how we would treat low back pain, herniated disc, and nerve pain. So the first thing that we're going to do is we're going to go in and we're going to do some some joint mobilization. We're going to do some stuff at each level here to help create movement. Remember we talked about this degenerative process and how it can create some stiffness in your lower back. This stiffness makes it hard for our body to get fluid transfer in and out of the disc, and it also limits the body's ability to heal. So we create some space, increase your range of motion, and we start to help the healing process. So we'll just call that mobilization. The next thing we're going to treat is your nervous system. Now, your nervous system is one long piece of connective tissue from your brain, down your spinal cord, into your peripheral nerves. And all that really means is what we can do is we can do some nice easy things to help create blood flow to your nervous system to help calm down that pain right there and help calm down your leg pain. And the third thing that we're going to do is we're going to come in and we're going to treat your core or your muscle system. Okay? Treating your core is a lot more than just doing sit-ups. Studies show that when you have unilateral back pain on just one side, what can happen is your nerve will start to not send a great signal to the muscles, and the muscles will start to shut down. And so when you go into PT, a lot of times what we're going to start with is some easy things that are more geared towards just retraining or refiring some of those small muscles that surround your spine. And then as you get better, we increase the intensity of those exercises. So, when you go to physical therapy for back pain, nerve pain, these are the things that you can expect to have happen. Your therapist should come in and they should do some joint mobilization to help create movement, to help increase fluid transfer, to help the healing process. They should do some things to help the nervous system. Nice, easy movements that are designed to help bring blood flow in and out throughout the day to help calm the nervous system. And then ultimately they should start treating your muscle system. Okay, let's go out into the clinic now and show you some of these things so that you can see what they are. And it's what you could expect if you were to come into one of our clinics here with Therapy Partners in North Texas.